Another subscriber writes in, my doctor wants me to take a statin drug. Should I? Another great question. I've said for years that statins are a blessing and a curse because they do incredibly good things, but they can do bad things. The problem with a statin is this. You don't want to choose a statin to lower a cholesterol number. To me, that's bad medicine, and I'll tell you why. Statins can have horrific side effects. I've seen side effects across the board. I've seen weakness of the limbs, weakness of the hands. I've seen almost like a pre-Alzheimer's condition where people literally forget who they are. We call it total global amnesia. I've seen difficulty with vision. I've seen liver problems. I've seen kidney problems, polyneuropathy. I've seen it all. Why? Because I'm a cardiologist and I see the side effects of statins that other physicians give patients. And they come to see me to get them off statins and to use lifestyle changes instead. Again, statins can have a light side though. Would I use a statin in certain individuals? Of course I would. Let me tell you how statins work. First of all, statins happen to lower cholesterol numbers. But the way they really work is that they're anti-inflammatory agents. And we know that inflammation is the sine qua non of coronary artery disease. So if you take an anti-inflammatory like a statin, could you do your vessels some good? Yes, you could. The other thing a statin does, it changes the blood shape of red blood cells. In other words, we use that term called blood rheology. It has an effect on blood aggregation where it can literally make the blood cells less sticky. So statins work in two ways. They're potent anti-inflammatory agents and they make the blood less viscous. So would I use them in a coronary population with advanced coronary disease? Of course I would. But I'm specific. I especially like statins in men ages between 50 and 75. Why not above 75? Well, I'll tell you, in patients over 75, I don't get as much bang for my buck. In other words, I don't really see the usefulness of a statin in elderly people because I'm more afraid of CNS effects and memory effects. And remember, when I ever choose to use a statin, I give every one of my patients, either male or female, at least 200 milligrams of CoQ10 because the side effect of statins is that they're marvelous cholesterol killers because they intercept about 20 different biochemical pathways. One of those pathways is for coenzyme Q10. So whenever you take a statin, you must give yourself CoQ10, and I like at least 200 milligrams. Now, what other populations do I use statins in? Well, I do use them in women, but only in women with advanced coronary artery disease, especially diabetic women, women with inflammatory mediators such as high C-reactive protein, women who are progressing downhill and they're getting more and more symptomatic. I'll use a statin. But in general, I have not been impressed with women with a statin as I am with middle-aged men. Where else would I use a statin? Well, in anybody with advanced heart disease, whether a stent, an angioplasty, a heart attack, anybody with a high calcium score, even a calcium score of over 200, I would use a statin drug, but not to lower cholesterol, folks. I use a statin to have an impact on the blood thinning, the blood rheology, the blood viscosity, and as an anti-inflammatory. So if I had a male, for example, with a very low HDL and coronary calcium, I would use a low-dose statin because a low HDL makes the blood more viscous. It makes the blood more like red ketchup. And that's the reason why a male with a low HDL is more prone to heart disease. So I would use a statin in that situation. But again, I don't treat numbers. One of the most common consults I saw in my office was a woman would come in with a cholesterol of 280 and an HDL of 100, and her doctor would put her on a statin. To me, that's bad medicine. Why? Because again, statins deplete CoQ10, and CoQ10 is one of the most important nutrients to protect your immune system. So, when do you take a statin drug? To summarize, if you have advanced coronary disease, you're a middle-aged male, you have inflammatory mediators, you have coronary calcification, you're diabetic, and if you're a woman where the coronary artery disease is getting out of control, those are the populations that would use statins. To treat your high cholesterol, no, I want to use lifestyle interventions first.